Hi, my name is Miss Deanne Harrison, and I am doing a head-to-toe assessment on my son. We're going to pretend this is a doctor's office. I've knocked on the door. I've introduced myself, said who I am. I have closed the curtain. If there is more than one patient there, I've closed the curtain for privacy. Then I am washing my hands for hygiene. So I'm washing my hands. Okay, the first thing I'm going to do is I'm going to check his armband, ask him what his name is. What's your name, sir?
Bruce Robinson.
And what's your date of birth?
January 25th, 2002.
Okay, I'm going to assess to see how alert and orient he is. What month is it, sir?
January.
What year is it?
2002.
And who is the President of the United States?
Oh, the great Donald Trump.
Donald Trump. Okay, good job. So the first thing that I'm going to do is I'm going to look at his overall appearance. I'm going to look at his skin. I'm going to look at his eyes, his ears, and all that. Sir, what I'm going to do is first I'm going to assess your head. So I'm going to touch you, so I just want to let you know what I'm doing before I do it. Okay, so the first thing I'm going to do is I'm going to assess the head, make sure that it's symmetric. Then I'm going to feel for any bumps, lesions, or anything like that. I'm also going to check his lymph nodes, make sure there's no masses, no swelling, make sure there's no drainage near his ears, no bumps. Okay, I'm going to look at his eyes. Now, normally you have an ophthalmoscope to use with that. You can use a pen light. Okay, I need you to look at my finger, and I'm going to take this light and go from the side and check to make sure that his pupils constrict and dilate. Normal pupil size is 3 to 5 centimeters, and his are 3, and they are reactive to light. Okay, now I would usually use an otoscope to look in the ear. You want to look in there, see if there's any wax buildup, see if his tympanic membranes, they should be pearly, gray. The cone of light should be at 5 and 7, depending on what ear, 5 o'clock and 7 o'clock. Okay, so when you look at the eye, you want to make sure that you see that the whites of the eyes are not yellow, that he doesn't have any redness. Okay, now I need you to extend your neck up. I'm going to look in your nose, see if there's any redness, any obstruction in there, any swelling, and there's not. Okay, now I'm going to use a tongue blade. Sir, could you please open your mouth? I'm going to take the tongue blade, I'm going to put it on his tongue, and I'm going to look in the back, and I'm going to look to see and make sure there's no redness, see if his tonsils are still there, there's no lesions. For the eyes, I'm also going to lift up on the eyelids and lift down. I'm going to look for any abnormalities. Make sure his glands are not swollen, no drainage. I'm also looking at his neck. Sir, I'm just going to touch your neck, okay? Feeling for any masses, nodules. I'm also feeling for the carotid pulse. You only want to do one at a time. Prior to doing my assessment on him, I'm going to disinfect my stethoscope. This is the diaphragm, this is the bell. The diaphragm is for loud noises, the bell is for lower noises. I'm going to listen to his carotid for any bruits, and you're going to use the bell for that. It's like a swishing sound. You're going to do it for a minute on each side. Sir, do you have any chest pain, any cough, congestion? Do you have any problems at all with your respiratory system? Okay. What I'm going to do is I'm going to have you stand up. And after I did his face, I'm going to go wash my hands again. Okay, sir, I am going to check to breathe in real deep and make sure that his chest is expanding evenly. Normally his shirt would be off, so I'm looking for lesions, bumps, any masses, irregular moles, anything like that. So I'm gonna do that for the front, and then I'm gonna do it for the back, feeling for expansion on all the sides. Go ahead and turn here. I'm gonna do this and do this. I'm also gonna check for tactile fremitus, which is like a vibration. On an adult, you should not feel it under intercostal 4 or 5. You should not be feeling it. So please say 99.
99. 99.
Turn around and then say 99, please.
99. 99.
Okay. Now, you're going to listen now to the lungs. You're going to do the 2 lobes on the front of the chest and the back of the chest. You're going to do the whole chest. You're going to listen with your diaphragm first, then with your bell. Your left lung has 2 lobes, your right lung has 3. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Now you're not going to listen to this with a shirt on or any kind of barrier. Breathe in. You're going to listen for crackles, rales, rhonchi, wheezes. Wheezes are common with asthma. Rhonchi are a snorus type of wheeze. You're going to listen for pleural rubs. Okay. So I've listened to all the lung fields. I have not heard anything. While I'm here, I'm going to feel for the carotid pulse. I'm going to feel for the brachial pulse, the radial pulse, posterior tibial pulse down here. Bryce, down here. Posterior tibial pulse and dorsalis pedis pulse. Okay, go ahead and sit down. Next, I'm going to assess his cardiovascular. Are you having any chest problems, sir? Any issues at all with chest pain, irregular heart rate, nothing like that? Okay, so what you're going to do is you're going to listen to all the heart sounds. Go ahead and stand up, I'm sorry. And you're going to listen to the aortic, which is on the right second intercostal space, pulmonic, which is on the left second intercostal space. Then you have the Erb's point, which is not a valve. Bryce, pay attention. Then you're going to have the tricuspid and the mitral. Now your mitral is the apex of the heart. This is your base, and this is your apex. You're going to listen for any irregular sounds. Lub-dub is normal. You hear a lub-dub-dub, that's abnormal. Okay. If you hear any galloping sounds, that's S3, S4, then that's irregular. And you usually cannot hear those with the bell. The best way to hear the S3 and S4 sounds is to have the patient lay on their left side, because most of your heart is on the left side of your body. So now I'm going to listen to all of the heart sounds with my diaphragm. Okay, and you're going to do the back side also. You're also going to do the diaphragm first, then the bell. Okay, and I don't hear any abnormal sounds. When I was feeling his pulse, it was regular. Okay, then next I'm going to have the patient lay down. Go ahead and lay down, take your shoes off and lay down. Could you lay down this way so that he can get you on the video here? Thank you. Let me put this underneath your head. When I was assessing the neck earlier, I was also, keep in mind, looking for jugular vein distension. I was also looking for that. that has to do with your heart also. So now I'm looking at the shape of the belly, looking at it. I'm going to inspect first, okay? Then I'm going to listen for bowel sounds. If he's got active, hypoactive bowel sound, I'm going to listen with my diaphragm. And he's got very active bowel sounds. I'm also going to listen to all the abdominal arteries that are here. Now you don't want to press too firmly, because if there is a mass, you can cause damage. So I'm going to listen for a swishing sound, and you should not hear any swishing sound, which means that there's a bruit. Just like the carotid, you don't want to hear a bruit, okay? So after I've done that, I'm going to palpate. I'm going to palpate lightly, all 4 quads, very lightly. This is about 1 centimeter. I don't feel anything, no masses, no nodules. Then I'm going to do the deep palpation, and I'm going to feel for any organs or masses. You should not feel the kidneys, the spleen. You should not feel the liver. That's abnormal. Okay. All right. Now I'm going to have you sit up. Okay. Now I'm going to check his strength in his fingers. Go ahead and squeeze my fingers as hard as you can. Okay. Go ahead and push up against my hands as hard as you can. Okay. Now stop me from, okay, very good. All right. Now with your feet, I need you to pick up your foot and press. Push as hard as you can. Very good. And press as hard as you can. Okay. I want you to, I'm checking his range of motion. Okay. I need you to turn your head from side to side. This is also checking your cranial nerves, and up and down. Range of motion is good. Okay. Now I need you to, all right, let's see, what's the next thing? Okay, so I checked all the strength. Now I'm going to check your cranial nerves. So I've got a bottle of vanilla extract. So normally you're not going to tell them what you have, but you close your eyes, and you want to use something that's not going to make them want to throw up or have a gag reflex. And sir, close your eyes and tell me what you smell.
Vanilla.
Okay, so that's your olfactory nerve. Okay, your optic nerve, we already checked that, how his eyes work, but what the cranial nerve is his peripheral vision and the Snellen chart. So the peripheral vision, I am going to, okay, look at here. I want you to tell me when you stop seeing my hands. Okay, to here, so that's very good. Okay, the next thing is the Snellen chart, which looks like this. You're going to have them close one eye and read to the furthest that they can, and on the side it will show you what their eyesight is. And then you do the other eye, and then you do both eyes. If they're wearing corrective lenses, you want them to wear those corrective lenses. This right here shows, for example, 20/30. This is what he can see at 20 feet that a normal person can see at 30 feet. Okay, so this is how you would gauge that. Okay, so you're going to do the cranial nerves 3, 4, and 6 together. That's the oculomotor, the trochlear, the abducen. Okay, you're going to look for involuntary shaking of the eyes. So you're going to take a pen light. I want you to look at this pen light and follow it, okay? Just with your eyes, do not turn your head. And you're going to go to all the 6 cardinal fields. Remember to do this, and make sure to tell them not to move their head, to keep their head still. Okay. So I already checked for the reaction to the light, and it was good. That's where PERRLE comes in, PERRLE. And then you want to check for accommodation. So I'm going to take this, and I want you to take your eyes and keep them on this and follow. So what's going to happen is his pupils should constrict and he should get cross-eyed, and he's normal. The next nerve that we're going to check is a trigeminal nerve. I'm going to have you bite down, okay? And then I'm going to have you try to open your mouth against resistance, and it's very, very good. The 7th cranial nerve is a facial nerve. He's already smiled, puff out your cheeks, and then he bit down earlier, so his facial nerve is fine. The 8th nerve is the vestibulocochlear. Okay, so I'm going to occlude one ear, side of the ear, and I'm going to whisper 2 words over here and see if he hears it. Cat, dog. What did I say?
Cat, dog.
Okay.
Fork, spoon.
Fork, spoon. Okay. So that is what you would do for that. Then the 9th nerve is the glossopharyngeal nerve, and that's when you take the tongue, you push it down with the tongue blade, and you say ah, and you see if the uvula moves, which I don't have a tongue blade, but that's what you would do. The gag reflex is also part of this, and you would check that. The 10th nerve is the vagus nerve. He's able to talk and he's able to swallow, so he's good. And I already checked his accessory. He turned his head up and down, side to side. Can you shrug against my hands? And he can, so that's good. Then the hypoglossal nerve is stick out your tongue and move it side to side. When his mouth is open, this is your opportunity to check the teeth, see if there's any loose teeth, cavities, anything like that. That would be a topic of discussion to talk about. Look through that, Bryce. That would be a topic of discussion to talk about if you see an issue with that. Going back to respiratory, I just realized that I missed something. When you are listening, you're listening to the bronchial sounds, which are over the trachea. They are loud, high-pitched, and hollow. And you're listening to the bronchiovascular sounds, which are moderate and medium-pitched, and heard over most of the lung fields, are the vestibular sounds, which are soft and low-pitched. Okay? So now, I am going to check his deep tendon reflexes. So, the first one I'm going to check is his bicep. So right here, what you need for this is a reflex hammer. I don't have one. For this purpose, this is the reflex hammer. Okay? And you're going to grade this from 0 to 4, and you want it to be 2+. Just like the peripheral pulses, when you check it, they should be 2+. So you're going to grab the arm, and you're going to have them relax, and you're just going to tap here. And what should happen is this arm should jerk like that, okay? This nerve checks your spine, spinal nerve C5, C6. Then we're going to do the tricep, which you'd go about right here on the elbow. You'd hit it like that, and the arm should go like that, okay? That's going to check the C6 and C7, excuse me. Then you're going to check the bronchioradialis deep tendon. This one's a little harder, but you go right above the radio, 2 to 3 inches right here, and your wrist should turn like this. So you would hit right here. And then you want to do the patella, which you would go below the patella like this and hit like that, and his leg should like that. And then you want to do the Achilles, same deal, right here, tap it with my imaginary reflex hammer, okay? If somebody has hyperactive, which is a 4, that's usually a pregnant woman that has preeclampsia. If they have hyporeactive, which is diminished, 1+, then that's usually someone with an electrolyte imbalance, okay? You want to know how to do this as a nurse, because when they go into your facility or your hospital, you want to check this so you have a baseline so that you know later on when you go to check that, hey, this person has diminished deep tendons, maybe they have an electrolyte imbalance, let's do some labs, okay? So just generally speaking, you're going to look at this person's speech, how they're talking, if they are coherent, okay? You are going to ask them what allergies they have. Do they use tobacco? Do they drink alcohol? Do they do drugs? What kind of support system do they have at home? Have they traveled in the past 30 days? How about their marital status? Or have they gotten their immunizations? And one thing that people miss a lot with immunizations is whether or not they've had their flu shot. So make sure to specifically ask them about their flu shot. The big thing with the assessment is you always want to make sure you know who the patient is, and you want to explain everything that you're doing to them and use hygiene with them, okay? So I'm going to continue to look at the lower body assessment. If you're looking down at the legs and you see a purplish color from here down, that's called hemosiderin staining, and that's usually a form of arterial disease or lack of hair. You want to see if they have a lot of hair growth or excess hair growth or not enough hair. You're going to look at their nail beds, their fingers. You're going to check their cap refill. You're going to do their vitals. You're going to check their blood pressure, their heart rate, their O2 sat. Okay, are they on oxygen at their home? If they have a colostomy, what does their stoma look like? Is it pink? Is it black? Okay, you always want to do some type of teaching with your patient, no matter if they're coming in for a physical or they're coming in because they're sick. With a male, I would talk to them, hey, how are you doing with urination? Is it hard for you to urinate? If it's hard for him to urinate, he may have a prostate problem. If this is a female, I'm going to ask her when her menstrual cycle was, or does she do her breast exams? Which males, that's another teaching that I would do on them. With the breast exams, the woman wants to check a week after her menstrual cycle. And men should check too. A lot of men are not aware. Are there any changes with your breasts? Have you noticed any discharge, inverted nipples? Okay, so this is very, very important. When a man's going to the bathroom and he feels his scrotum area, is there any lumps there? These are all important things that need to be talked to. Another teaching thing that I would have, depending on their age, like Highlands County, the highest rate of STDs is in the geriatric community. They obviously need some education. Hey, I know that you can't get pregnant, but you can still spread sexually transmitted disease. Here's some protection and information for you. With the younger ones, that's also another teaching method that, sex is a broad subject, and it's not just actual intercourse, it's actually other things too that they're doing that can give them diseases. So these are all the things that I would talk to with the patients. So I've checked everything. I've checked the skin, I've checked their reflexes, the neuros, I've checked which are the cranial nerves. I've listened to the vital signs. I've checked the abdominal area. I've done teaching. I've checked for edema. I checked the nail beds, the cap refill, which for him is less than 2 seconds. So you want to take all this information, and when you do your assessment, you are going to inspect first, then you're going to listen, then you're going to percuss, which is another form of listening, and then you're going to palpate. So you're going to do this all in a certain way for a certain reason. And all nurses should know this. Of course, you're going to use the cranial nerve assessment more for ICU, trauma, ER, babies. But every nurse is going to do a respiratory assessment, so that's very important. And you're going to do heart assessments, so you should know the basics. So this is my conclusion to my whole situation. Another thing that I just remembered, when you want to check sensations, you use a monofilament, and you can also take different objects, sharp, dull, and soft, and feel on the upper body, is this soft, and have the patient tell you if it's soft, dull, or sharp. So that's, these things come to me later on because I'm really nervous. But if you remember the basics, you should be fine. And then if you practice, then when you really have to use it, it shouldn't be so hard. So that is it for my presentation, and thank you so much.